We're here today to show core decompression of the femoral head for avascular necrosis. The idea behind core decompression is to prevent eventual total hip replacement. We describe a technique that allows for seamless delivery of biologics and bone support into the core decompression tract. These are some examples on imaging of avascular necrosis of the femoral head. We have an X-ray AP left hip showing avascular necrosis of the femoral head. Also MRIs, both T1 and T2 views of the AVN of the femoral head. The indication for core decompression is to not have any subchondral collapse in the presence of a crescent sign. You can see the crescent sign on the MRI images on both T1 and T2. We are here at the back table to show you the instrumentation for the core decompression set. We have both reusable and disposable instruments. The disposable instruments include a 2.4 guide pin, a 5.0 reamer, expandable reamer, which is torque limited, as well as the application guide for the Biologics. For the reusable guides, we have the drill guide with a handle, drill guide insert, as well as the T-handle with a torque limiter. Critical part of core decompression is consideration of biologics. These are the biologics that I use. We have the Arthrex DBM Vortex threaded needle, AlloSync Pure. We have the quickset cement. What we do is with the BMA needle, draw the bone marrow aspirin, mix it with the AlloSync Pure to fill the cavity of our core decompression to allow for healing. The quickset is then used to backfill to allow for to prevent leakage of the BMA. This specimen has been prepared with a flush fit cannula inside the joint. We're focusing on the open technique, but we will show arthroscopic pictures of the femoral head. In preparation for our technique, I draw my landmarks. We see here is the ASIS with the iliac crest. I draw the inner and outer tables. I'm drawing the anterior femur, posterior femur, and the tip, the greater trochanter. I use the Arthrex Vortex needle to get my bone marrow concentrate. I do this early in my case so that the bone marrow concentrate is ready to be mixed with the AlloSync Pure. To share a pearl that I use to get my targeting and keep the incision small, I lay a guide wire right on top. You can use a 2.4 guide wire from the set. And I want to get my angle. If you can take a C-arm shot here. Another one. Another one. Right, and most lesions are anterior superior, so we'll mimic that in our demonstration today. We are going to draw a line right over the guide wire towards the femur, and that'll give us an idea where we're going to start our incision. Next thing I'm going to do to see our starting point is I'm going to poke the guide wire or guide pin right on the femur, if you can take a shot there. And another shot there, to see on our starting point. So I like my starting point. Here I'm also seeing the posterior aspect of the femur, where we're going to start a little bit posterior on our incision. I can feel anteriorly, so I know I'm in a good spot. This is where I will center my incision. All right. This will be my incision for our core decompression. So I have my drill guide right on the lateral cortex, and I'm bringing my guide pin right inside. Let's have a shot here. We have our guide pin in an appropriate position. As you know, most femoral AVN lesions are anterior superior. You can see we're somewhat superior to the central portion of the femoral head. Now that we have our guide pin in appropriate position on the AP, short of the articular surfaces, we're going to check a lateral view. Accurate targeting of our guide pin into the AVN lesion, which is typically anterior superior, is critical for this case. With multiple fine adjustments, we see on the lateral view of the hip that our guide pin is somewhat anterior from the center point, which is exactly where we want. Now that the pin is in good position, we are going to take out the drill sleeve and put the cannulated 5mm reamer over the drill. As we get to the subchondral bone, the bone will feel stronger and more sclerotic. Shot, please. And it's important to make sure you're not engaging the guide pin in the reamer, so that as to not advance that guide pin through the cartilage. Shot, please. Shot, please. Right there. At this point, we're going to advance a stepped 5mm drill sleeve using our slotted slap hammer. Shot there. Okay, so here we see that the step collar is flush with the cortex, and at this point, the sleeve is appropriately inserted. So at this point, we will take out the reamer first and then the guide pin. So this is the torque limiting expandable reamer. Just to show you how it works, this black knob here is to expand it from 6 to 18 millimeters. So to prevent premature deployment of the blades inside the bone, we hold it right behind the black knob, no pressure from posteriorly on the T-handle, and we insert. And we'll confirm with C-arm to make sure that we're at the appropriate position and depth. It's important to note when you use this reamer and start expanding, go up one notch at a time, have at least a few turns, and if you're feeling a lot of chatter, don't prematurely advance too quickly. So here I'm at 6 millimeters, turning over to 9, and this is at maximal expansion. Shot there, please. One more time. Good. All right, so now that we're at 18 millimeters, we want to check on the lateral view, which we did, to confirm appropriate position. And here, what I'm going to do now is I'm going to withdraw this back and still turn to get chatter so that we can create more decompression of that AVN lesion. If you can take a C-arm shot, please. So as we pull this back and keep turning at 18 millimeters, we're creating a larger cavity for filling of our AlloSync Pure with bone marrow concentrate. Take a shot, please. And you can hear the chatter. Shot again, please. Good. All right, so at this point, I'm going to bring our reamer back down to 6, and we'll pull this out. Shot there. At this point, with the reamer out, it's a good idea to flush out any necrotic bone and tissue. We use the applicator from our disposable set to insert. Take a shot, please. C-arm. One more. Good. I'll remove the inserter at this point. Insert syringe with saline. Shot again, please. And we'll just flush it out under some pressure. Okay. So this is our 250 millimeter nanoscope needle. I'm going to take a look inside our decompression tract and our tunnel to see if we got to the sclerotic bone and necrotic bone. Obviously, in this cadaver model, you won't see the necrotic bone, but you can see very clearly very good resolution of the intraosseous space. At this point, we have 5 cc's of our AlloSync Pure with 5 cc's of bone marrow concentrate. I will mix this in a 1-to-1 ratio. I also have the quick set here ready to go once we are done with our AlloSync Pure mixture. We get the quick set ready for backfill preparation. We have our Biologics applicator, which we're going to insert into our drill sleeve, and we will confirm appropriate depth. I like to be right at the entry point of the cavity. Take a shot, please. Good. Take a shot, please. So right at the entry point of the cavity, I've taken my 5 cc slurry of bone marrow concentrate and AlloSync Pure and transferred to 1 cc syringes, which we have here. These will secure themselves to our applicator, and we'll start injecting. In the beginning, there's not much resistance because we're just filling our applicator. But once we insert our plunger, we'll start to see this mixture go into our decompression tract. So I recommend using the plunger slowly so as not to penetrate the articular surfaces in case there's any chondral fissuring. Yeah. X-ray, please. X-ray, please. Yeah, you can see filling. I'm getting a little bit of resistance here. I'm going to pull back our applicator. X-ray, please. X-ray, please. All right, so we got nice filling there. Now what I'll do is just for the backfill for the quick set, I'm going to retract our applicator back further. X-ray, please. Right to about that level. Okay, now we have our quick set that's been transferred to a syringe for easy application. I'm going to insert that right into our applicator. And we're going to inject that in. All right, good. We'll finish that in. And then we're putting the plunger in here to complete the insertion of the quick set. And shot there. Good. Once we're in, we'll take this out. And we'll take our whole system out at this point. Shot again. Very good. So at this point, the surgery is complete. We will have post-op images that'll show on X-ray our decompression tract filled with quick set as well as the bone marrow concentrate with AlloSync Pure. I have an X-ray view here. We'll also have a MRI view of the decompression showing filling over time. I also have a bilateral hip MRI where a patient has AVN on both hips. On the right hip, you can see there's still bone marrow edema from the AVN. On the left hip, this MRI was done over a year after surgery. You can see complete bone healing and no evidence of any necrosis on both AP, coronal, as well as axial views. As you can see, the core decompression surgery we performed today was done under a minimally invasive technique with about a 2-centimeter incision. Appreciate you taking the time to watch our video today. Thank you.